So here's Elliot and Keegan. Hello guys.
Hello vet students. Welcome to the Worldwide Veterinary Services International Training Centre here in sunny Tamil Nadu in India. This is your front gate. Yes. Well, my name's Keegan, the other member here is Elliot. You can't hear anything because this is a massive highway, but you'll start your entrance here at the sunny, sexy ramp.
So they're in their scrubs at the moment because they've just finished surgery. What are you saying, Keegan?
To the left we have the offices and the classroom where you'll be taking your nightly lectures, depending on what time you finish surgery. Not every night, mind you.
There's another student there, Gavi. Say hello. Hi. Yeah. Oh, yeah.
This way leads down to the dormitories where you will be staying in luxurious accommodation. Come on down, see the excitement.
Alright.
You've got 3 bedrooms, or 3 dormitories, all with bunk beds, so we're split up between gender and then however many people are there. Fortunately, the bunk beds are quite nice and you
Look
don't
at the view.
have to sit.
Sorry.
And yes, you have this amazing, gorgeous view.
I mean it's difficult to see now, but it is amazing. I guarantee you. Okay, so this is dormitory 1. This is the boys' room.
This is where the boys live. Very messy, but that's to be expected.
Right, let's go in. So, bunk beds. Yeah.
Got your bunk beds, little towel rest. Fun.
Let's see the toilets.
It's a bit messy because it's our last day. Acceptable.
Come on, show us the toilets.
Yeah. Welcome to the sunny toilets. You will have the pleasure of using a genuine Indian toilet during your stay here at WVS, which involves lots of careful manoeuvring and manual flushing, and a lovely Indian shower.
Oh yeah, don't forget the shower.
Which generally involves pouring water over your head. Very nice. And then now if you will follow me this way, I will take you to the kitchen and the dining area.
Where the food is.
Where every day you will enjoy 3 lovely square meals prepared by our lovely chef. She takes excellent care, and it's very, very delicious. It is entirely vegetarian friendly, so you'll be just fine if you prefer that dietary option. And I'm walking backwards, so I want to make sure that I don't follow.
Nice view again, guys.
Lovely.
Nice view.
And here is where you'll be taking your meals. Nice leisurely breakfast at 8 o'clock every morning, and then you spend 10 minutes in here for lunch in between your surgeries, if you're lucky. And then dinner is served every evening at 8:30. Don't forget to try the lime chili. It is the greatest thing in the entire world. Ah, so good.
And we get, like, it's all buffet. So, nice rice and curry. Very nice. Now where are we going, guys?
Gonna go to the kennels.
Kennels.
And see where all of our inmates are kept.
Right, okay.
Right this way, ladies and gentlemen, right this way.
So what's the routine then?
Well, we start every morning at about 8 a.m. Get up, have some breakfast. By 8:30, you need to be down at the kennels, split into 2 groups and ready to sedate your dogs. We use a pre-medication cocktail of xylazine, sometimes butorphanol. And every morning you'll either be sedating your dogs, or you'll be doing rounds through the kennels checking on yesterday's surgeries. So while rounds are going on, you've sedated your animal and you're preparing your table for surgery. Everyone gets an IV catheter, fluids, warmed fluids, and they're scrubbed, shaved for surgery. Pain medications. They do use antibiotics routinely, but they use them very well.
Dogs Trust, it's sponsored by Dogs Trust.
Yes, of course. Yes. So these are the kennels which are getting cleaned for the weekend. Everyone's going down to Goa for 2 weeks.
And I think all of the dogs are split into whatever area they come from. So when they're transported here and transported back, they all go back to the same area that they've come from. But it's quite straightforward. You've got a cage in here, just some crates. Dogs are fed a nice concoction of chicken heads and feet with rice and eggs. Absolutely delicious.
Lovely. Oh yeah, and show us one of those. What's that?
This is a catch pole. It's very important considering most of these dogs are street dogs and therefore not quite as friendly as your average German Shepherd or Golden Retriever. You'll have an assistant every day who will be quite happy to catch the dog for you, hold on to it while you inject it for sedation before you begin your surgery and your before you begin your anesthesia and your surgery.
Okay.
It's important to note you're not actually allowed to handle any of the dogs while they're awake, which is actually quite good, because some of them may have rabies or other diseases which generally be quite aggressive. So we let our trained dog handlers do that while we give our sedation injection. We leave them alone for 15 minutes, then we come back and prepare them for induction. Oh, look at these sweet little guys in here. Sleeping beauties. The weather is absolutely perfect right now. It's up in the mountains and it's hot with a cool breeze. Woo! Sometimes you get visits from monkeys, which is always fun and terrifying.
If you follow us, will take you down to where you'll be doing it.
Alright.
So after you've sedated your dog, you and the assistant will bring it down into the surgery, where you have, in the 10-15 minutes it's taken for your dog to go to sleep. You've prepped your table. Your first stop will be right here at the scales. Your assistant will weigh himself and the dog, give you some idea as to how much your dog weighs.
Okay. Is Dr. Ashwin there? Say hello, Dr. Ashwin. Right, I think he's a bit shy.
So this is your general preparation area, everything here. Usually there's lots of tables set up. 5 tables, 5 surgical teams. You'll come in, your assistants will bring the dog in, you'll place an IV catheter, you'll induce them. And then you'll do a full physical exam. We've got all sorts of fun things. Meloxicam, ketamine, diazepam, xylazine, propofol, butorphanol, lidocaine, ivermectin. Sometimes people in the local area do bring their dogs in here and they get treated for free, and that's what's happening down here right now. So after your dog is prepped, your partner will come in, they will take over your anaesthetic for you, and you'll go prep for surgery. They're the cinches here.
Range of glove sizes there?
Very nice. We always use caps and masks. We have a sort of isolated prep sink using an iodine scrub. I think it's a really important note to say that we are up in the mountains in regional India, and we're doing sterile prep, hand washing, and sterile gloves. It is entirely possible and easy to do in these circumstances.
Look, another view.
It's a lovely view you get while you're scrubbing in for your 5 minutes of scrub. And 5 minutes of contact time is required. So you then dry yourself off with a towel. Sterile towels indeed. Put on your gloves, and you come this way. At which point your dog will be waiting for you on one of these tables. There will be a set of sterilized instruments that you'll take out in your pack. You'll lay it out on one of your kit tables, all set up. You'll check, make sure your dog is as shaven and as clean as you'd like it to be. You then place your drape. You check with your anesthetist, your partner for the week, make sure that everything is going just fine, and then you begin your surgery for the day.
So there's an assistant over there. Say hello. These assistants help us out every day, and if we didn't have them, we wouldn't have been able to do this for 2 weeks.
So every patient is monitored by a dedicated anaesthetist who is your partner, and then you swap surgeries afterwards, but you have a whole anaesthetic sheets where you record everything in from patient weight, when they came in, when you're doing the surgery, gender, location, if they've had vaccines, what medications they've received. So it's nice to have a checklist to double check yourself, and you're monitoring continuously throughout the procedure. We don't use gas anesthesia here. We use either propofol or diazepam to do total intravenous anesthesia, which is exciting.
Oh yes, and then after your surgery is completed, you'll get rid of any extra surgical materials you may have that have not been contaminated, because we do like to conserve supplies here as much as possible. You will then clean up your site, and you'll be taking your dog over here to the recovery area. And we've got two lovely dogs. That's enough. At which point they'll be kept next to hot water bottles so that they stay warm. They get warmer after their surgery time. Once they wake up, one of the assistants will come over, handle the dogs, and then take them back out to the kennels, where they'll finish their recovery and finish their wake up and have their first post-surgery meal.
So this little girl was just spayed, and she's just recovering now. We do intradermal sutures because most of these guys are going to be released back to the area they came from after 4 or 5 days, so they don't have to come back with suture removal, but that's some very nice work. Beautiful work.
So how long will these take to wake up?
I suppose it depends on the patient, how long their procedure was, but the xylazine generally seems to be keeping them sedated quite a while. If we find they're getting cold or they're taking a long time to wake up, then we can reverse the xylazine, and they usually wake up quite quickly. We use warmed fluids during the surgery to help maintain their temperature, and most of these guys only drop a degree or two at most during the procedure, which is really nice. And flies are an issue, but we are managing our expectations and understanding our limitations. And I suppose that's the end of our tour.
That is everything. We hope that you enjoyed the little tour around WVS ITC, and we hope to look forward that you can make a journey out here.
We really hope you come here because this has been an amazing 2 weeks and we've learned such a lot. We're now actually surgeons. We can call ourselves surgeons.
It's amazing. And there's our lovely camerawoman.
Goodbye and good night.